Hello, everyone. I'm Tracy Matisak, and it is my great pleasure to welcome you to Real Talk COVID-19 Vaccines presented by Jefferson Health. We are here today because, real talk, there is a great deal of confusion, misinformation, and skepticism about the new COVID-19 vaccines, particularly among communities of color. And it is critically important to have accurate and reliable information because, as many of you know, the right information can make the difference between life and death. So we are grateful that all of you are here because you will play an instrumental role in helping to disseminate that information and helping people make informed decisions about the COVID-19 vaccines. So to provide that critical information, we have assembled a great panel of experts. But before I get to them, it is my great pleasure to welcome Dr. Stephen Klasko. He is the president of Thomas Jefferson University and CEO of Jefferson Health. Dr. Klasko, welcome.
Tracy, it is great to virtually see you, and I can't wait until we can actually be together with the Philadelphia Speaker Series and get back to some level of post-pandemic normalcy.
Yes, me too.
Thank you. Thank you for that introduction. And thank all of you for joining us this afternoon. This is incredibly important. You know, it's an extreme understatement to say this has been a rough year. And I've learned so much. Everybody on this panel has learned so much. At Jefferson, we've now discharged more than 10,000 patients who were hospitalized for life-threatening symptoms of COVID-19. And we have been challenged in ways that we've never been challenged before. Incredibly proud of the work that we've done, our frontline folks, all 32,000 folks that work here at Jefferson. But we've also learned a lot of things that have shaken us. The pandemic has shaken the world, it's hurt our businesses, and it's been especially devastating for our communities, and especially devastating for our communities that are already been underserved. We know we have much to learn about this disease and how it affects families and neighborhoods of our patients. And what we learn from this disease will help us, I believe, with other chronic diseases to make sure that everyone in Philadelphia, everyone in our area has the access to be able to thrive without health getting in the way. Now, I'm talking to one of my colleagues from London. The three things around leadership that I've learned. I think
Dr. Klasko, I think we lost your audio there for a moment.
I'm sorry.
There we go.
Yeah. The three things that I've learned as a leader through this is we need to over communicate, over collaborate, and over care. And I think in the communication piece, we need to talk more, and we need to listen more, and we need to build strength here at home, because healthcare really starts at home. So the folks out here are the key to building that strength, which is why it was so important that we wanted to talk to you. I really want to recognize so many people, but I'll start with Dr. Sandra Brooks and the team to put the Real Talk initiative together. What we know is that people trust people they know. You trust your family, and you trust people that you can trust, whether that's in your church or your synagogue or your mosque or your friends. I hope you'll come to know Dr. Brooks and this team, including Lizette Martinez, my incredible Executive Vice President for Diversity and Inclusion, and many others. My commitment is that Jefferson will be a leader and that together we will build strength for our communities. So Tracy, thank you for everything you do, and thank you all for being here with us today.
Well, thank you so much, Dr. Klasko. Thanks to you and to the entire Jefferson team for the tireless work that you have done across the region in battling COVID. A couple of housekeeping notes before we welcome our panel. We are here today, of course, to talk about a critical issue, and that is low confidence in the COVID-19 vaccines. Now, due to hospital privacy policies, we are, of course, unable to share specifics regarding any COVID-19 cases or any patient information, of course. The information and the statistics that you will hear have been gleaned from our experts' research as well as from their colleagues around the world. We've also received some great questions already during the registration process, but we do invite you to add your voice to the conversation. You can do that by utilizing the Q&A icon. Now, depending on your device, it may be at the bottom or at the top of your screen. If you're not seeing it, you can just kind of toggle your mouse a little bit and your cursor and it should pop up, or you can even tap your screen if you have a touch screen, and that should get you where you need to go. Also want you to know that any and all questions submitted will only be seen by myself and our panelists, and we will do our very best to get through as many as possible before our time together is up. So with all of that said, it is now my pleasure to introduce and to welcome today's panelists. Dr. Jonathan Gleason is the James D. and Mary Jo Dinella Chief Quality Officer and Executive Vice President of Jefferson Health. Dr. Gleason, welcome. Dr. Sandra Brooks is a professor in the Department of Obstetrics and Gynecology and Senior Vice President and Chief Medical Officer of Thomas Jefferson University Hospital Center City Division. And Dr. John Zirlo is the Director of the Division of Infectious Disease at Thomas Jefferson University Hospital. Now, before we get started with our Q&A, I'd like to invite each of our panelists to just give us some opening remarks to get us started. So Dr. Brooks, why don't we start with you?
Well, thank you very much. It's my pleasure and honor to be here today. Having joined Jefferson just prior to the pandemic and in my role as Chief Medical Officer, I've been deeply involved in the planning and implementing strategies to care for our very ill patients in our hospitals and intensive care units. To say this year has been tumultuous is an understatement. The pandemic, racial reckoning in the aftermath of the horrific murder of George Floyd, glaring disparities in COVID-19 infection and deaths, economic upheaval and uneven governmental response. Throughout, our frontline workers have shown up. However, despite their weariness of the pandemic, given the mixed messages and the long-standing structural issues that keep many Black and Brown people below the poverty line and often marginalized, a sizable fraction remain fearful and concerned about the prospect of being vaccinated. Given those headwinds, we knew that vaccine deployment would be challenging. We learned very quickly that digital outreach and top-down communication would not be enough to bridge the skepticism that exists in some communities. And while for many, the arrival of the vaccine was a ray of light that might signal an end to this horrific pandemic, that the vaccine could be viewed with skepticism is not a surprise to those who face ongoing racism and have knowledge of past deeds in research and medicine. Although we commonly speak in generalities, we know that Black and Brown people are not a monolith. We must proceed with caution, as there are many who recognize the historical missteps of the past and are working tirelessly to make our systems safer and more equitable. Given the urgency of our current situation, we recognize that if not addressed, lack of confidence in the vaccine has the potential to derail efforts to immunize the very communities that are at highest risk. Recognizing that many people rely on trusted relationships, we understood that quickly needed to hold conversations about the vaccine in the context of relationships and people-focused outreach.
Dr. Brooks, thank you so much. Dr. Gleason?
Thank you. Pleasure to be here this afternoon. Really is an honor. And to talk about this important topic. I think right now, so grateful that we have vaccines. We've been through so much, all of us. I don't think anybody on the line has not been personally touched by COVID, and the amount of suffering that we've seen is just so profound. Dr. Klasko, I think, said it best. We've discharged more than 10,000 patients from our hospitals. These are folks who were so sick that they needed hospital care just over the last 10, 12 months. And so I'm so grateful that we have vaccines. I'm deeply concerned that there are individuals out there who can be helped and who are really struggling with the decision. And I think that what we've learned through our experiences in providing vaccines within the Jefferson workforce, which is large, as Dr. Klasko mentioned, is that it's that conversation between individuals. It's a conversation happening within the context of an established relationship that really can help people make a decision about the vaccine. So, I'm really grateful for everyone who's here. We've got a tremendous group of leaders here on the line who are all going to be trusted messengers along with us, and who I hope will also recruit other trusted messengers within their sphere of influences to go places maybe that they can't go, and to have conversations about the vaccine. It's amazing to me that we're joined today by people from all around the country. And I do want to just point out that vaccine distribution is a related, critically important issue that is obviously being handled locally. We see that just in our region with very different strategies in New Jersey and in Pennsylvania. So, that's not the focus of this conversation, but obviously vaccine availability is a challenge all around the world, and definitely here in the United States. Locally to us, the news on this seems to be changing every day for all of us. And we've taken advantage at Jefferson of every opportunity that we've had to help our public health agencies with the vaccine deployment. We're partnered in New Jersey to run mass vaccine sites, and in Philadelphia and Pennsylvania have had other plans, and we continue to advocate and submit proposals for vaccine distribution within all of our communities. When we do receive vaccine, every dose that we receive is distributed as quickly as possible, really prioritizing speed. And also our distribution plans are heavily weighted towards vulnerable populations where the virus has had such a devastating impact. So with that, I'll say that I'm just excited for this conversation. I appreciate everyone who's here, who wants to be a trusted messenger, and who's also going to go out and help us find more trusted messengers to have these conversations. So thank you.
Thank you, Dr. Gleason. Dr. Zirlo?
I've been involved with COVID really from the start of it all, as many physicians have in my position. And though it was kind of a shock to see how it had really developed and emerged, it wasn't terribly surprising to anybody in infectious diseases, as through my career, I've watched epidemics that have developed that include AIDS and SARS and MERS and Ebola and Zika. And so this one obviously has affected us more than probably any of them, quite frankly. Really from the start of this, my primary job has been one of education, learning about the virus, learning about just everything and disseminating that information to both the enterprise, of the Jefferson enterprise, but as well to our patients. We've gone through the issues at the start of how to protect our patients and our staff. Then we really have worked on just how do we approach these patients, what treatments are available, and we've continually refined that. Really up to the point now where we are is, I think we've crossed a threshold. We've had vaccine development really come along very, very quickly. And really right out of the gate, we've had 2 vaccines that turned out to be very, very effective with a technology that's quite new. And now, though we're far from the end of the battle, we are certainly very much into it, in the sense that we can now bring people in for vaccination, and the vaccines work incredibly well. They're very well tolerated, and we can really start to see what the end will look like over the next several months. And so I remain very optimistic. I've been optimistic from the start, and I remain very optimistic as we move forward here, because we now have the tools to take us, beyond COVID and back to what we hope will be something related to normalcy in our lives. And I think we're all anxious to get to that point.
We are indeed. Thank you so much, Dr. Zirlo. Very, very encouraging news. Time now to get into our Q&A. And Dr. Brooks, let me begin with you, because of course we've mentioned that the webinar today is entitled Real Talk, COVID-19 Vaccines. And I know that you are very much at the center of Jefferson's Real Talk campaign. Can you tell us a little bit more about what that is and the story and the importance behind it?
Certainly. So I would like to make sure that the widely discussed vaccine hesitancy that we're referring to, or low vaccine confidence, is not turned into a reason not to use every tool available to reach out to our vulnerable African American, Black, and Latinx communities with our vaccine efforts. But recognizing that we might have differing uptake, in advance of the vaccine rollout, Jefferson Health conducted a survey of our employees' intent to receive the vaccine. And of the 10,000 people who responded, we found that some, most strikingly the African-American employees, signaled a lower potential intent to become vaccinated. We realized that the gap might just be the tip of the iceberg, given the response rates varied in different groups. We huddled quickly to brainstorm about what to do. Unsettled by what I saw, I immediately reached out to one of the individuals that oversees our cleaning and nutrition staff and asked if he could help me to get in front of a few of those employees. We were all spread out in a large conference room, but you could feel the intensity and emotion when I asked them how they felt about vaccination. I began walking through the service areas of the hospital and developed a deeper understanding. Out of those insights and in collaboration with other leaders came the Real Talk campaign. We decided we needed to not only tackle employees' concerns via digital means, but that we also needed to have one-on-one or small group conversations in the context of what Senator Hughes has coined, trusted messages through trusted messengers. We believe that this concept can be translated into many communities. This time, like no other time for us to think about how we protect not only ourselves, but our vulnerable communities. And we have no choice. But we have a lot of ground to cover in a very short period of time, and that's why we're enlisting everyone's help. Civic leaders, businesses, community partners, members of clergy, friends. Thank you.
So, Dr. Brooks, just as a follow-up to that, I mean, the story that you described right there at Jefferson is very telling, and we've talked about the low confidence level in communities of color around these vaccines. Can you talk a little bit more about why that is?
So we do have a slide to show that might help us to depict this. So this slide entitled Current State of Vaccinations in Our Community, if you will see, the dark blue represents vaccinations in Pennsylvania, the dark gray represents Philadelphia, light gray represents New Jersey, and the gold represents nationwide vaccinations. The columns on the left reflect that Black individuals or African Americans who've received the vaccine across the state of Pennsylvania represent only 1.7% of the recipients. And 1.2% of the recipients were Hispanic Latino in Philadelphia. And in Philadelphia, those numbers are 16.5% for Blacks or African Americans and 7.5% for Hispanic Latinos. So those numbers fall far short of representing the population. The columns to the extreme right indicate the large percentage of unknown race, which indicates a wide variation in how that information is being collected. At this time, we don't really know how much of the disparity is due to vaccine supply or the initial invitation or distribution mechanism, but we do know that at least a fraction is related to low vaccine confidence. To quote a recent New York Times op-ed penned by 60 of our nation's top Black physicians and scientists in the National Academy of Medicine, our country is facing a public health crisis on a level not experienced for more than 100 years. It should be reasonable to expect that all citizens can rely on their government and health institutions to protect them. But for many Black Americans, trust in the government does not come easily. Far too often, our health has been ignored and even abused in the name of science. So it is no surprise that polls indicate that Black Americans are far less likely than other groups to intend to get vaccinated against COVID-19. They go on to say that disinformation has pervaded social media and is an assault on our people. These are powerful words. And the disinformation in the setting of a pandemic has created a perfect storm, leading to low confidence in a vaccine at a time when we need to be able to respond quickly. It's important that people know that as a result of the atrocities such as Tuskegee syphilis experiment or the exploitation of Henrietta Lacks, or forced sterilization of women in Puerto Rico, that numerous safeguards have been put in place to protect vulnerable communities. Healthcare institutions still have a long way to go in repairing trust, but we don't have much time with regard to getting the message out to communities about the importance of vaccination. And that's why we're enlisting everyone's help. In the course of speaking to some of our service employees, one man I spoke to said, well, you're expecting me to trust Jefferson. I'm not a doctor, but I have questions about how fast this vaccine was developed and why suddenly everyone cares whether or not I get it. Black men have it tough in this world. I have a target on my back everywhere I go. It was a conversation like this that lended a sense of urgency to marshal a small army to assist with the effort. And we also realized we needed to have an empathetic response to people's concern about some of the larger issues that are intertwined with people's decision to get vaccinated.
Well, thank you so much for that, Dr. Brooks. And Dr. Zirlo, we know that there are two vaccines right now that are available in the United States, the Moderna and the Pfizer. We know that there's one in the pipeline from Johnson and Johnson. Can you talk about these vaccines, the ones that are currently out there, and what is in the pipeline? What do we need to know about them?
Sure. Perhaps you can show a slide. I have just one slide to show that'll kind of compare and contrast the vaccines. So you can see on this slide that we have the Pfizer and Moderna vaccines. They're very similar in design in that they're so-called mRNA vaccines, meaning that they have a little package of a genetic material that allows our cells to produce a viral protein to which we develop an immune response, which protects us from the virus. Now, these are both in use in the United States, once again. In fact, they're the only two in the United States. Now, on the really positive side, they have very, very high effectiveness. We found in the studies that they're virtually identically efficacious or are active about 95% of the time. And this cuts across age, it cuts across race, ethnicity. It even cuts across people who have underlying medical problems, for example, diabetes or heart disease or COPD. It seems to work quite well in all of those individuals. And importantly, even for those for whom the vaccine doesn't fully prevent COVID, it prevents severe COVID, so that instead of a COVID where people are hospitalized and are at risk of dying, those COVID cases we've seen in vaccinated individuals have just really been a bad cold, and that's not a bad outcome. Now, everybody understands the challenges. The Pfizer vaccine requires it to be super frozen, very cold handling, and it's not always easy to deliver in the community, whereas the Moderna just requires standard freezing. And of course, the other challenges with these vaccines are that they require 2 doses. For the Pfizer, it's 3 weeks apart. For Moderna, it's 4 weeks apart. The AstraZeneca vaccine and the Johnson & Johnson are both similar design, and in some ways very simple in that they use a virus, a harmless virus, to introduce a genetic messenger that allows for the production of a protein to which then we become immune to the virus. Now, neither of these are available in the United States yet. I would guess Johnson & Johnson will probably be approved within the next 2 to 3 weeks, is my guess. They're not quite as effective as the Pfizer and the Moderna vaccine, although the AstraZeneca had some mixed results. The Johnson & Johnson vaccine seems to be fairly active, 72% effective. And in the same way, both prevent severe COVID, which is really an important piece of data. Now, neither of these require extreme cold, and so they're more amenable to being used in the community. Much like the Pfizer and Moderna, the AstraZeneca requires 2 doses, right now at 4 weeks, but it's possible that the second dose could be extended out to 12 weeks, which would allow more people to get their first dose of vaccine. So that is yet to be determined. The Johnson & Johnson vaccine, of course, the main advantage is that it requires just a single dose. And finally, we have the Novavax vaccine, which is still in late stage trials, that it's a protein to which we develop an immune response to the virus, not yet approved, a pretty high level of activity. Again, good at preventing severe COVID, doesn't need ultra freezing environment. And once again, though, it's a 2-dose vaccine at 3 weeks. So that's really the general layout. We hope that the Johnson & Johnson vaccine will come online. And furthermore, we hope that both Pfizer and Moderna can continue to push out more and more vaccine, and so we can increase the pace of vaccination in the country.
Dr. Zirlo, I'd like to drill down on that a little bit about what the vaccines actually do to your body. And you hinted at it in your response, but I think there has been confusion about whether the vaccine makes you immune. Does it make you less sick if you contract COVID? And then, of course, there is the all-important question, when we are fully vaccinated, do we still have to wear masks?
Yeah, first and most importantly, none of the vaccines can give you COVID. That's a really important concept. So in essence, they're just, all of them have the same ultimate function, which is to produce a protein, what's called a spike protein from the virus, that allows our body's immune reaction to occur. And once we develop this immune reaction to this vital protein, then that seems to protect us from the virus. So that's that in a sense, that's the biggest way that it works. We seem to see that all of the vaccines so far tested are really quite safe. What was the last question? Let me make sure I've caught them all.
Oh, about masks. So when we're fully vaccinated, will we still have to wear masks?
Yeah, it's interesting that the CDC recently, just within the last 24 hours, came out with some guidance suggesting now that for individuals who had an exposure to somebody with COVID, that maybe they're more fully protected, and healthcare workers, for example, don't have to be quarantined. So we don't really know the answer to that yet. The biggest concern we have is, even though the vaccines may prevent people from getting really sick from COVID, it's still possible that people can get a very mild form of COVID that doesn't make them sick, but it could make them infectious to other people. And so I think we're taking it very cautiously and advising that even with vaccination, that we still pay attention to masking and social distancing until we get more information about whether or not that's true.
Yeah. So don't get rid of your mask just yet. Dr. Gleason, I know that you have had the COVID vaccine. Can you tell us about your experience, whether you had any side effects? What do people need to know as they prepare to get vaccinated?
Sure. So I'll say I had absolutely no issues with mine, and actually received my second dose tomorrow at 1 o'clock. So, I'll let you know, Tracy. But we've, I was in the kind of the later phase. We have provided vaccine to more than 20,000 people at Jefferson at this point. We have a tremendous experience at this point with the vaccine. So we've discharged more than 10,000 patients who were critically ill with COVID. And now we've given, tens of thousands of vaccines at this point, including first and second doses. And the vaccine is a clear winner on safety, over COVID. And so, from seeing both of those experiences, both the incredible impact of COVID on people who are critically ill, and then just the safety of the vaccine that we've seen with the deployment, across our health system, makes it a really clear choice. I think Dr. Brooks just beautifully articulated what we're talking about with the Real Talk campaign, which is that when it's not a lack of information, primarily with many folks, it's a lack of trust. And so really what we're asking folks to become a part of is this Real Talk campaign to facilitate thousands and thousands and thousands of conversations. People need to have a conversation within the context of a relationship. And so, what we're about to do is explain to everyone how that Real Talk trusted messenger training is going to happen, and how you can recruit people from within your sphere of influence to come and receive that training, so that then you can go out there and have those conversations. This is, I've been asked so many times by people in the community, how can I help? How can I help? How can I help? This is a way for people to help. And everybody can do it. I have 2 10-year-olds and an 8-year-old. They can help, because all it is that folks need to go out and have conversations about the vaccine and talk about, hi, my name is John, and I took the vaccine. I have 2 parents who are both at high risk, and I would do anything to protect them. And this is my way of doing that and protecting them. What are your thoughts about the vaccine? And it really is, that's something that literally everyone can do. And when we look at the national data, and Dr. Brooks shared, what's already been distributed among the vaccine. But if you look at the surveys, and nationally, there are some surveys reporting that only half of the public in the United States are planning to get the vaccine. So, there's an opportunity for everybody to have a conversation. And we think the folks who are on the line here both can become trusted messengers and can recruit many others to also become trusted messengers. And we're going to be providing that training over the next couple of weeks.
Yeah, a lot of work to be done, and relationships are everything. Dr. Gleason, you set us up very nicely for me to go to Dr. Brooks. And Dr. Brooks, let's talk a little bit more about the Real Talk campaign. What do people know? What are the next steps?
Sure. Well, once we realized there were differences in the intent to receive the vaccine, we began to watch the response to the invitations really carefully. And not only did we recognize there were differences in response to invitations and people making appointments, we also realized that people's access to their email was a barrier. So we launched the Real Talk campaign as a way to bridge the divide, to mitigate what we thought might be a looming disparity. So we started to invite diverse, multidisciplinary groups of individuals to come to train to become trusted influencers and messengers. And we developed a training program, and we provided resources and facilitated making appointments. So really, essentially, what, as Dr. Gleason mentioned, the person who serves as a trusted messenger is a trusted source of truth. They're cognizant of racial, ethnic, or cultural concerns. Above all, they're approachable, engaging, and non-judgmental, willing and able to connect with individuals in multiple settings, and willing or able to escalate concerns and provide feedback. So we provided backup for people if they have questions, or if their teams have questions. And in these sessions, we discuss strategies in which the messengers can engage people one-on-one or small group or via Zoom, and address questions or concerns about the vaccine or relay their experiences. We have provide information to commonly asked questions or mythbusters and resources. And the messengers has, as I said, a direct route to escalate those questions if they need to. We really aiming to reach out with care and concern. So since then, we've trained multiple groups of these trusted messengers, some of which have led to invitations to speak to larger groups. And we also field a lot of questions about potential side effects. I tell them that serious side effects are rare, but we aim to be very open that a small percentage of people might experience flu-like symptoms. But as Dr. Zirlo has said, and Dr. Gleason has echoed, that in no way compares with getting a disease that kills almost 1 in 200 people that it infects, some of whom are dealing with symptoms long after infection. So our trusted messengers also relay their stories and why they believe so strongly in the effort, as Dr. Gleason has said. So in this slide, we can see the impact that the Real Talk campaign is having. The flag is placed at where we started the Real Talk campaign. If you look at the top right-hand side is our African-American employees. And over the course of a month, we were able to quadruple the uptake of vaccination in our African-American employees. So we're really not where we want to be eventually, but we've made a tremendous amount of progress. And I think we recognize that we believe we've made a difference. And that's why we're really sharing this message with you all today.
Yeah. So Dr. Brooks, as these real talks take place, what is the response like? And what are some of the things that audiences want to know about?
So I've spoken to hundreds of people, one-on-one or in small groups, socially distanced, in the cafeteria, in sterile processing, in the service areas, in the bowels of the hospital, on Zoom. I'll typically start with, it was a small group. Did you get your invitation for the vaccine? Even though I know that all of our employees have gotten their invitation because the invites were sent out several weeks ago, but that helps me to know if they're plugged into our communications. And then I might ask, well, what are your thoughts about getting the vaccine? And then depending on their answer, I might tell them a little bit about the vaccine and how our vaccination efforts, again, as Dr. Gleason has said, we've vaccinated close to 30,000 people. We talk about how independent groups reviewed the data and vouch for its safety. We talk about, open about, as I said, the side effects that they in no way relate to, compared to contracting COVID. I also I asked them if they have elderly parents or relatives, and tell them that my parents are 91 and 92, and I'm so grateful I've been able to be vaccinated. So even though we still need to wear our masks and remain socially distanced, that I'm relieved that I can visit without feeling that I'm going to harm them. One of the men I spoke with in a small group indicated just general distrust of the government and mentioned Tuskegee, which ended in the 70s, by the way. And I acknowledge the past is shameful, but also let them know there are a tremendous number of safeguards that are in place, principally as a result of some of those atrocities. And that although the vaccine was developed seemingly rapidly, they didn't skip any steps, and that the investigators included a diverse group of scientists, one of the leads of whom is an African American. So we try to just let the conversation flow. If it's a larger group, we will oftentimes invite them to submit questions in advance, so we can make sure we can vet some of those questions. But I do, in those one-on-one conversations, I let this particular individual know that one of the reasons I was called to speak to him directly really speaks to the reason I went into medicine in the first place, is to care for the health of my community. And that we really have a sense of urgency to communicate how important it is for us all to have widespread uptake for the vaccine in order to see the end of the pandemic. And there may be a small percentage of people who can't get the vaccine for serious ongoing medical concerns, and it's our responsibility to protect them. And we want to be able to do that. And the reality is no one's perfect with masks or social distancing. And even if we're perfect, our coworkers may not be. We know that. And some of us have relatives we've not seen for months. Don't we want to see them again without fear? So this particular conversation took a turn when his coworker said, I've had several family members die from COVID. I want to do anything I can do to keep my family safe. Sign me up. And since then, I've had dozens of conversations. One example I had with our valet personnel. Every morning I was talk to them. Have you gotten your vaccine yet? Do you need help? Finally, she was ready about a week ago, and I saw her today, and she said she's doing fine, and it really made my day.
That is wonderful news. Well, on that happy note, let's go to some questions from our audience. There are quite a few stacked up in here. This one sounds like a good question for Dr. Zirlo. And Wendy wants to know, should ibuprofen be avoided after getting a vaccine? And what about Tylenol?
Yeah, that question has come up. I mean, in theory, any medication that might reduce fever, which is sometimes seen after vaccination, especially the second vaccine, theoretically could reduce the response to the vaccine. But I think that is really theoretical. And I think and backed by the CDC, say you probably shouldn't take a pre-medication before a dose. But if you develop fever and it's really troublesome and fever and aches, I would suggest taking Tylenol.
Okay. Dr. Brooks, someone asks, is there a chance that confidence grows in vaccination as it becomes more accessible? It is hard to make and get to appointments at clinics that are available. And I know we can't get into specifics about distribution, but your thoughts about whether confidence will grow as availability grows.
I believe it will grow as availability grows and as we have more trusted messengers getting vaccinated and getting the word out. Absolutely.
Okay, let's see. There are so many questions here. Let's see. Okay, here is one that says, will COVID medically high-risk people who get the vaccines be moved off this high-risk list, thereby improving their quality of life? If yes, would this be a good selling point? I'm not sure if I quite understand the question. Will COVID medically high-risk people who get the vaccines be moved off the high-risk list? Dr. Gleason, you want to, or Dr. Brooks, you want to?
Are they related? They may be related to asking about age or people who have a history of transplant or cancer. So the vaccination won't change their underlying medical condition, but it will obviously protect them from potentially having severe COVID. I think that might be what they're getting to.
Yeah. Let's see. Here is a question, and this one is from Michael, who says, what top 3 ways can trusted messengers support the advocacy, administration, and public assurance of the COVID-19 vaccine? So kind of an opportunity to sort of reinforce the message here, Dr. Brooks, but 3 top ways that trusted messengers can be effective.
Well, I think once we can certainly, if the individual has been vaccinated, to share their story and really and there are volunteer efforts that potentially be available if they're part of a community. When vaccines are more widely available, there'll be opportunities to help sign people up. There'll be opportunities to help people with transport. I think we can also have a celebratory, if it's an employer, we can have a celebration surrounding our milestones with vaccination. I think we can make sure that we're adhering to CDC guidelines, and because that's going to be the temptation will be for people to become a little bit more relaxed with that over time. I think civic leaders can also help to create a common message. Anywhere you have an audience of one or more people, I think we can support vaccination efforts and be public with our advocacy.
Okay. Question for Dr. Gleason. What do you tell young people who are healthy with a concern for the long-term unknown effects of the vaccine?
So I actually might hand that to Dr. Zirlo. We have a world-renowned infectious disease physician with us. So I would, the best thing for me to do is hand that to Dr. Zirlo. But I just want to thank that last question came from Pastor Robinson. And I also think that one of the primary things that anybody on this line can do is direct people to our website at Jefferson Health, where they can go scroll down and they can find Real Talk and click on the Real Talk site. And then those folks can go and sign up for one of our Trusted Messenger training sessions that Dr. Brooks will be doing over the coming weeks, where they can be equipped with information aids, conversation aids about how to have these conversations, and then learn more from Dr. Brooks and her experiential knowledge and how to navigate these really difficult conversations with folks. So, to me, the most practical guidance on that is, we've got tools and conversation guides that are available free of charge on our website. They're in multiple languages, and we're expanding that by the day. And those training sessions will be occurring just over the next couple of weeks. So just directing folks to our website so that they can go and sign up for a Trusted Messenger training session and gain access to those materials to go have those conversations. That's something that anyone can do.
All right, great. And then Dr. Zirlo, to the question about young people who are healthy but have long-term concerns about effects from the vaccine.
Yeah, I think one of the two important questions we don't know about the vaccines are, number one, the long-term side effects, and number two, how long does the immunity last from the vaccines? But with respect to the side effects, in our long history of vaccinations, what we've seen and what we expect is that 95% plus of side effects that we typically see with vaccines, we will see within 6 weeks. And we've already followed a large group of individuals in clinical studies well beyond that. And now we've vaccinated now in the United States more than 30 million people. And so we're constantly watching for that and looking for long-term side effects. But happily, so far, we've not seen anything. On the other side of it, though, we certainly do see long-term consequences from COVID infection, even in young people. And in fact, in children, they get this odd condition where this kind of inflammatory condition that we don't quite understand. I don't think that a day goes by that I don't get a message, a call, an email from someone who says, gee, I had COVID and it's 6 weeks, it's 8 weeks, it's 3 months, and I'm still feeling lousy. Can you, what do I do? And my answer is, I don't know, quite frankly. And so we're dealing with that very real problem of COVID causing disease and death, and sometimes these long-term consequences or side effects, with the potential, the possibility of long-term side effects from vaccines that frankly we haven't seen yet.
Yeah. And just as a follow-up to that, Dr. Zirlo, what about pregnant women? What do they need to know about all of this?
Yeah, the vaccines had not been tested on pregnant women in a systematic fashion by the time they were approved, but many pregnant women, in fact, did get vaccinated. And so we're following those closely over the course of the entire country right now. And important groups like the American College of Gynecology and Obstetrics have come out with statements about using vaccination in pregnant women, because we have some pregnant women who carry risk factors for COVID that should they develop COVID during a pregnancy, they would potentially suffer significantly from it. So our guidance right now, and we continue with this, is the discussion should be made between the woman and her obstetrician, but we will not deny women vaccinations just because of pregnancy. In fact, in many cases, we actually would encourage it.
Okay. Question for Dr. Brooks. Dom wants to know, what can we as lay people do to help those who are hesitant, as we, or at least I, am not a medical professional. So people who may feel intimidated because they don't have a medical background to make the case for vaccination. What do you recommend?
I think, as Dr. Gleason suggested, if you could attend our training session, we will give you some tips, tools, and resources. I think expressing if you have a personal relationship with that person, expressing your personal intent to become vaccinated and the reasons why, I think that can be powerful and compelling as well. And, just what Dr. Zirlo has stated, more than 30 million people have been vaccinated. So there are some people who said, well, I want to wait and see. But now we've had a very huge number of people who've been vaccinated. And I think we also want to look toward the future, a future without where we can gather and celebrate again. So I think it's a message of, of care, concern, and optimism, and looking towards the future.
Yeah. Interesting question that I'm not sure which of you will be best equipped to answer this. It's a local question with national implications. And Rachel says, can Jefferson's relationship with sports teams, including the Eagles, be helpful in reducing vaccine hesitancy? And I think, because we've got people watching from around the country and professional sports teams all over the country, there may be some national implications for that as well. So I'm not sure which of you, I see you, Dr. Gleason, nodding over there. So I'm going to throw that one to you.
So, I think this is one of those where the answer is yes, everyone can help improve confidence in the vaccine. And we are joined today by some leaders of some national, some large sports franchises, and they're here because they want to participate in this effort as well. So I would say the answer to that is yes, they can have an impact, and we're delighted today that we're joined by several franchises who are interested in trying to play their part. I will also share that we've had a number of celebrities reach out and ask to participate and tell their story about why they're interested in receiving the vaccine. I think there's a broad acknowledgement that that everyone can have an impact just by sharing their own story. And so, I think a lot of people with large spheres of influence, many of them on the line here with us right now, are all thinking about how they can play a role.
Yeah. I want to just ask one last question for Dr. Zirlo before we begin to close out the program. And this question is, will vaccinations be required yearly?
Another question that we don't know the answer to. Once again, since we don't even know how long immunity lasts from natural COVID infection. We think for many months, and we have at least some data to support the fact that vaccination results in immunity for many months, but it's pretty imprecise at this point. It's quite possible that on a yearly, or maybe 2 yearly, or maybe 5 yearly basis that we'll need booster vaccinations. We haven't talked about these variants that have been around, but it's quite possible also that there'd be another strategy to booster with a vaccine that has some potency or additional potency against any of these variant viral species that might arise. So it remains to be seen. But, as I've said many times, every year for many years, we vaccinate hundreds of millions of people for influenza. And so if that's what it requires, a yearly vaccine, perhaps in the wintertime or every 2 years, we can do that. We can fold that into medical care.
Yeah. Well, on that note, we are just about out of time, but I do want to give each of our panelists just a brief moment for some closing thoughts, key takeaways, however you like to think about that. Dr. Zirlo, we'll start with you.
Yeah, I guess my key takeaway is this. When people ask, should I get vaccinated? And I say, I wouldn't hesitate. There are almost no reasons not to be vaccinated. And so I willingly pulled up my sleeve and I got vaccinated, and I'm an evangelist that these vaccines have come along. We've developed them very quickly. They're effective, and I wouldn't hesitate to be vaccinated. And I think that should be the message.
Yeah. Dr. Gleason, what do you say?
So I would say ask this group to come and participate in one of the Trusted Messenger training sessions. They're about 30 minutes. Dr. Brooks is going to share with you some of more of the stories and things that she's learned in having so many conversations. It really is amazing to hear about how many of these conversations unfold. But go and recruit others as well who you think that those criteria that Dr. Brooks had mentioned, people who can be trusted messengers, people who do have relationships and who can have conversations that'll have an impact towards people's confidence in the vaccine. So my closing statement would be to please send people to our website, have them click on the Jefferson Health Real Talk campaign site and sign up for a training session so that they can help us in trying to get the vaccine out there. So thank you.
And that's a great point. Before I get to Dr. Brooks, I do want to mention to everyone in our audience, you submitted such great questions and we had tons of them. We apologize that we couldn't get through all of them, but there will be follow-up materials, and you'll hear more about that from Dr. Brooks and others. There will be follow-up materials that hopefully will answer a lot of the questions that you have. That said, Dr. Brooks, you get the last word.
Oh, wow. Actually, we do have a couple of slides where we can show some of the examples of some of the resources. So, these are some examples of some of the things we can provide in terms of stickers, Zoom backgrounds. The next slide, please. We also have the Mythbusters and what to expect from vaccination that we could provide. And we also have that in Spanish as well. And these are the dates of the educational sessions that, again, we can sign up for through our website. And I think we've emphasized that you don't have to be clinical to express empathy and concern for your friend, coworker, or your employees. Nearly everyone knows someone who's been affected by COVID-19, whether through illness, loss of a job, or assumption of responsibilities for care of their child's education. So once the vaccine is widely available, I believe we can defeat this disease and accelerate vaccination through our concern for one another, which is what we will need as much as we need the facts. So we need both. And employers can help by providing information on their websites, by partnering with organizations to support community vaccination sites, by helping their employees to get vaccinated, by donations when possible, volunteering, and by setting example with the other CDC guidelines that we still have to adhere to. Our vaccination sites have a quiet but celebratory mood, and I think we all need that. Yeah. To paraphrase that New York Times op-ed, with the COVID infection and death rate numbers like we've seen, this moment requires leaders to stand up and to lead to help save our people and the nation, to break the stranglehold that COVID-19 has on our country. Quite simply, vaccination is one of the biggest and best tools we have in our toolbox. So think how you could support this effort in nominating a trusted messenger to undergo the training, include the messaging in your town halls, celebrate your vaccination rates, celebrate low absentee rates, connect with employees with information on how to sign up, and stay connected with your local Department of Health and CDC guidance. So this is no time to stand on the sidelines. We have to continue to advocate for equitable distribution of vaccine. So yes, there is some lack of confidence, but in addition, we know that the infrastructure for administering the vaccines for vulnerable population has been slow. So we really need everyone to take a stand, to volunteer, facilitate, and advocate. I think we also, for our churches, fraternities, sororities, and synagogues, mosques, We suggest that we create networks to create a common message and overwhelm the misinformation by creating a campaign of truth and love for one another to get the word out and publicly celebrate. It can't be overstated how important this is. And this is our biggest tool that we have. We don't have all the answers, but we do know, as our colleagues have said, that to date, millions of people have been vaccinated safely and that serious side effects are uncommon. So fear is a powerful emotion that I believe we must counterbalance with hope. Hope is the wellspring from which all other good emotions emerge. And as finally, as Dr. Lavis said, we have to encourage everyone to claim your place in line to get vaccinated and to do this for yourself, for your community. We're asking you to trust our advice because we're a part of you. And we believe that together we can save lives.
Dr. Brooks, thank you so very much. I want to thank all our panelists. I think you'll agree that we've really been able to share some great information here today. I want to thank all of our doctors for being with us, Dr. Gleason, Dr. Zirlo, Dr. Brooks, Dr. Klasko as well. I want to thank Jefferson for all the work that you have done in fighting COVID over this last year. And I do want to remind our audience that we will be posting additional information and resources. The conversation is just getting started. So keep an eye out for some follow-up information that will be coming your way where you can sign up for real talk training sessions and some next steps. That said, also want to thank David Brownstein and the whole team at Jefferson for bringing all of us together. And I especially want to thank all of you for joining us and for your role in helping people understand the importance of getting vaccinated and being willing to step out and engage with people in your sphere of influence. So thank you so much for making time to be with us. Stay safe. Have a great evening. Good night, everyone.